Joining us now is Dr. David Markwell with Ridgeline Counseling. Our subject of the day is vaping. Dr. Markwell, how are you today?
I'm doing well, Brian. Thank you.
Good to have you with us. I know this is a serious subject. FDA has labeled this a national epidemic. I'm going to say maybe it's us, myself, and a lot of parents, but this seemed to come out of nowhere. It just came out and it's there all of a sudden. Is that what you see? And what exactly do you see where the vaping, the prevalence now is just, it's just all these kids all of a sudden overnight. So let's start our conversation on vaping today.
Sure. Well, it definitely seems to have exploded overnight, but the concept of vaping is not necessarily a new thing. In fact, I came across an interesting fact that in 2014, that the Oxford Dictionary named the word vape as their word of the year. So it definitely has been around for a few years, but I would agree it definitely has seemed to exploded for several reasons. One, I believe, is the use of other substances now in the vaping instruments versus when it first came out, it was more of an alternative that people would say to smoking tobacco products, and they would say that it's safer at that point in time. That was at least what was being pushed with the flavored different oils and things. But now it's become more of an issue because it's no longer just the flavored oils that seem to have been marketed to the younger generation, but they're also using other oils like the CBD oils or the synthetic CBD oils, which I know in the three counties in that area, in this area, Fannin and Gilmer and Pickens, there were definitely some concerns in the very recent past of students who had some medical emergencies due to that.
How about every generation there's peer pressures with high school students will stay in high school. There's peer pressures there. And kids that are being pressured to, this is cool now, and their parents finding out about it. Take us through some of the ways parents can talk to their children. I remember all too well my mom saying, "Is everything okay at school?" And the answer, yes, was okay, and move on. How do parents approach the question, their children, and get an open conversation where this subject is concerned, Dr. Markwell?
And that's a very good point, because I do think it has to start with the parents. It definitely can be supported with, the local authorities and the school system, but the parents have to play a major role. And I know it's a very difficult conversation that some parents may not want to be a part of, but because of the seriousness of it, and how it has exploded overnight and the peer pressure that comes from it. And I think also just some of the marketing that seems to imply that it's a safer alternative, which of course it's not. The research is now showing that everything from not just only the chemicals that are being used, but also the vapors itself can create. I read one study that said that they're now linking moldy type of spores that can come into a person's lungs based on the moisture that is coming from the vaping and things. So parents definitely have to become knowledgeable. One of the things that I appreciated from the area school systems up there, as well as the district attorney's office, also the CDC, is that they provide information showing images. It's no longer the typical long e-cigarette type of vaping now. It takes different forms, hidden forms in so many different ways. So I think the parents have to become knowledgeable first of the awareness that it is something that's very prevalent, the types of instruments, even the names that are being used, code names, other different types of things that are being used versus just CBD oil. There are other different terms that are being thrown out there. One of them that I read was I believe a term called chronic, or something that was being sold. The other things parents can do, of course, is definitely encourage them to be open with their parents. In other words, the parents will tell the children, that this is a conversation where we want honesty and openness. We're going to encourage it without any type of, severe judgment at this point. We just want to create that atmosphere of openness in our communication. And then I think a couple of things, not just simply the openness of whether it's being done or not, but I think the parents have to share with them the health issues, as well as, legal issues that could come over time, but the health issues that are involved. And then more importantly, not to be, vaping themselves around in front of the kids or allowing other adults to vape in front of the kids. I think that in so many ways sends a mixed message. Kind of like the old saying is, don't do as I do, do as I say. And that in itself can create, for adolescents, a sense of contradictory beliefs and some, hypocrisy on the part of the parents. And then also, being firm with their boundaries if for some reason it does become an issue with the family.
Dr. Markwell, I want to just double back a little bit, because when I opened up, I did say vaping and just came onto the scene. And you are correct. Vaping has been around for several years, but what has taken place now is it's the CBD oil, I think that's what you said, and other things where it's now cool to the kids, and it just overnight it seemed to take that direction overnight with the kids. Let me ask you this now, parents. So you find out your kids are part of, because here's the confusing thing, you find out your kids have one of these vaping things to vape with. I don't even know what they call them, but they have one, and they're getting the oil, and they find it out. What kind of conversation do they have with the children once they find that out? And what would you recommend they do? Get, maybe some get together family counseling, or how would you recommend they handle that if they've got a child that's vaping and they catch them? I don't know a better word than catch them, and they're concerned they're going to get the wrong products in there. So elaborate a little on that.
Sure. Well, as a therapist, always advocate that if a family or an individual is in need of, counseling, there are definitely professionals that can, assist and advocate, for the family in those situations as well. But one of the things that I always encourage parents to be aware of is that there is to be very aware of the difference between a punishment and a consequence. A consequence basically is the result of a choice. It can be positive or it can be negative. So if I brush my teeth on a regular basis, the end result of that is a positive consequence: cleaner teeth, fresher breath, hopefully lesser cavities, and so forth. The exact opposite, if I choose not to brush my teeth on a regular basis, it will lead to the end results, which would not be positive. It would be negative results. Possible increase in cavities, breath stinks, and those kind of things. So with regard to finding, for example, these types of things, I definitely always encourage parents, to remove them. It's not always an easy thing, but to remove them from the children, because most adolescents are not, their brain is not developed to the point where they are able to make those adult-like decisions. Even adults themselves sometimes struggle with decisions. And so to remove those things, and not give them the opportunity to exercise their own adolescent judgment on that. And then, of course, because at that point, it's not a punishment. It's not like you're taking away something that's not connected. You're removing the device that is a consequence of the choice, which is an unhealthy choice. So it falls more into an area of consequence versus just simply a punishment.
Well, I like the way you explained that there are two areas to discuss: the punishment and the consequences. And so, I've heard the DA and many talk about, yes, there's legal ramifications for what they're doing. They can get in trouble, face legal charges, but for the most part, it sounds like people want to offer help. So what kind of help can people get? Instead of, I've heard the DA say, no, we don't want to just lock you up. That's not our goal, is to hope to lock you up, because that's not really solving what has happened here. Our goal is to get you help. So what kind of help can these young people get and reach out for?
Sure. With regard to a family, there are different ways. Parents could go to a professional and work with that professional on ways to be firm, and fair with the consequences. Learning to, kind of have that authority as a parent. Especially if they have felt like they've lost some power and authority with their children, the parents themselves could do that. The family itself, if there's some family dynamics going on where this is something that is a result of maybe some deeper issues going on within the family, that could also be addressed. And then also for the adolescents, I know a lot of adolescents may not view counseling and the mental health profession as something that's on their side, but it definitely is. It's something in which they could come and openly talk about their struggles with it, the peer pressure, as you mentioned, Brian, that comes from it, the fear of whether or not it's becoming more of an addictive part of their life, or if it's something that they can work through, and also work on the relationship with their parents.
Dr. David Markwell, appreciate it. Is there anything else concerning our subject today, vaping, that you wanted to make sure you got through to the audience before we closed?
Other than just for the parents to continue to not turn a blind eye to what's going on, and to recognize that, it's very important for them to be involved. It's not always an easy topic or an easy subject, whether it's vaping or other things. But as parents, that guardianship that comes with that. And then, of course, the other thing that I'm very grateful for is that the area, the district attorney, the school system have, fully recognized the seriousness of it, not just from the recent health scares of many of the students, but the legality of it, and they're approaching that. And I know recently there was a panel that they had where they were discussing that. So the awareness, I think, is definitely a very positive thing that I'm grateful in seeing.
Thank you, Dr. Markwell. We appreciate you being on with us today to discuss this serious subject. We've been on now with Dr. David Markwell. He is the Ridgeline Counseling. Dr. David Markwell, Ridgeline Counseling. We've been discussing vaping. We have discussed it here from so many angles, from the district attorney to high school principals to other law enforcement, because we want to bring the most information on this serious subject. Dr. Markwell's phone number is on the screen, and if you would like to talk to Dr. Markwell or set something up to get an opportunity to see Dr. Markwell, the number is right there on the screen. Again, Dr. David Markwell, Ridgeline Counseling. Thank you, and we'll be right back.